dhikr, remembering Allah, and rise for the month of Ramadan. Oh, Ramadan.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters, you are welcome to Ramadan Diet. Hi, I'm Fadila Okunu. Hypertension has been termed a silent killer. Yet, we have Muslims with this condition fasting during this month of Ramadan. Join me as we examine nutrition tips for hypertensive Muslims during this month of Ramadan. Bismillah.
Oh, Ramadan.
Hypertension is a chronic disease of the cardiovascular system. When I say something is chronic, that means it lasts a long time. And cardiovascular means heart. So it's a long-term disease of the heart. So can hypertensive patients fast Ramadan? I will say yes and no. Yes, if the condition of the patient warrants that the patient fast Ramadan. And no, if the condition of the patient does not allow the patient to fast Ramadan. Ordinarily, because hypertension is a chronic disease, patients of high blood pressure or hypertension are allowed to leave fasting in the month of Ramadan if they cannot fast. The condition of the patient will determine whether the patient will be able to fast Ramadan or not. Number one, the severity of the signs and symptoms of that hypertension. Symptoms and signs may be different from one person to another, and if the person has very severe symptoms, I will advise that the patient should not fast. Number two, the medication and the frequency of taking the medication. If the patient has to take drugs because of the condition that the patient has found him or herself, and the patient has to take drugs more frequently during the day, then I will not advise that patient to fast Ramadan. Number three is that if the side effects of this medication is affecting this patient, for example, if one of the side effects is dizziness, fatigue, constant headache, and things like that, then I will not advise the patient to fast Ramadan. Fasting can lead to hypotension. This kind of situation, hypotension is more critical than what? Than hypertension. However, there has been some scientific studies that have said that intermittent fasting has helped with hypertension, has lowered patients' blood pressure. Intermittent fasting is fasting that is not regular. Maybe fasting today and you not fast in the next 2 days, and it goes on like that. But we all know that Ramadan fast is not intermittent fasting. It's a continuous fast. So, that is why I've mentioned earlier that if the condition of the patient warrants that the patient fast, then the patient can fast. They should talk to their doctor before they start to fast. The doctor that knows their history, that knows the medication they are on, that knows the kind of symptoms they show, that knows maybe they have had any complications from hypertension before, it is very, very important that the doctor should be aware that they want to fast. And the doctor will be able to advise them better on how to fast. Number two, patients of high blood pressure or hypertension should prevent dehydration as much as possible during fasting. It is normal that when an individual is fasting, you'll be dehydrated. But they should drink a lot of water during suhoor. And they also drink a lot of water during iftar.
You should be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, laytaka dawman qarib. Oh, Ramadan.
Alhamdulillah, may Allah grant us sound health to fulfill our spiritual obligation to Him. We say Jazakumullahu khairan to all our sponsors. May Allah accept this from them as an act of worship and grant them their heart desires. For comments, sponsorship, and advert placement on the program, call the numbers on the screen. Till we meet tomorrow, inshallah. Assalamu alaikum wa wa rahmatullahi wa barakatuh.
That is for the remembering Allah and rise for the month of Ramadan. Oh.